Good morning. Can you hear me okay? Good morning. It's a pleasure to be here. Thank you, Dr. Katari, and thanks to you at St. Peter's University Hospital for the opportunity to be here today. The topic this morning is healthcare reform, and as Dr. Katari mentioned, it's based on a book for which I am principal author called The Battle Over Healthcare: What Obama's Reform Means for America's Future. It's a nonpartisan analysis of healthcare reform and where we're headed. I approached writing that book with a question. How did it happen? Since the time of Franklin Roosevelt, America has tried to have universal health insurance coverage in this country. And for decades, people have tried, but it failed. How did it happen this time? What went on behind the scenes and the deals that were done with the important players in it? The healthcare industry, the insurance industry, the drug companies. What went on? What made it happen? What were the special ingredients? And did America get a good deal? Or finally, we're going to see costs controlled in healthcare. We'll talk a lot about that today. Will healthcare be safer? Will there be less overtreatment? For you as future physicians, there are many residents in this room today. What will healthcare look like for you as future physicians? Really important question. And finally, did we build in healthcare reform a sustainable system? We built a house, but will it be one that generations will be able to live in? Let's get started. Why healthcare reform? Just a reminder of why it's so important. You here at St. Peter's see it every day. Last night at dinner we were talking about the clinic for the uninsured here. And you see patients come in with advanced heart disease, unmanaged diabetes, people with cancer that has spread. Why? Because they've lacked health insurance, because it's too expensive, and the enormous suffering that takes place because people don't have access to health care. This is a photograph of what happens when volunteer physicians, nurses, and others come together on a weekend to provide health care for the uninsured. This has been America's safety net. And yet another picture. If you're uninsured and can't afford medical care, this is where people will drive hundreds of miles to receive needed care, whether it's a pair of eyeglasses, a sore tooth that needs to be pulled, or you've gone for cancer treatment but can't afford the follow-up care. This is where you go. This has been health care in America for millions of people. And so the decisions about what to do about it then went here. This is a picture of Blair House in Washington, D.C., the White House summit in early 2010. Democrats and Republicans together, debating, quarreling over what it should look like, if it should even happen at all. And the battle over healthcare will continue. Today, healthcare reform is the law of the land. It's been signed by the President, passed both houses of Congress. The Supreme Court affirmed the constitutionality of the individual mandate last month. But still, the battle will continue. Republicans have vowed to repeal it. If not that, they have vowed to prevent it from being funded. And there are many substantive issues that remain to be addressed. We still have a shortage of primary care physicians. The imbalance between primary care and specialty care remains a huge challenge. Are there enough physicians and nurses to take care of the 32 million people who might have health insurance coverage because of health care reform? And then we have the surge in the elderly population as the boomers turn on Medicare. 30 million people over age 65 will be on Medicare in the next 25, 30 years, additional people. Do we have enough doctors and nurses to take care of them? Healthcare reform couldn't fix everything, but there's still a lot to be done, and the battle will continue. So this presentation is a nonpartisan look at healthcare reform. The focus will be on two main areas, coverage and cost. We can't cover the whole waterfront in just an hour because it's such a huge bill. The bottom line is, if you want to build a house, did healthcare reform provide a good foundation? Will it be around, and will it support people with good care for generations to come? So in the future, the residents who are here now, 40 years from now, you look back on it, did we do healthcare reform right? That's the question. There'll be 4 parts to this presentation this morning. Did healthcare reform diagnose the right problem? You as physicians know how important getting an accurate diagnosis is. Did we do that as a matter of public policy? The second question is, what will be covered and what will it cost? Third, we'll focus on what does healthcare reform mean for you as future physicians and for those of you who are currently practicing. And finally, where are we headed from an economic point of view and fiscally? Can we sustain financially the systems that we're creating? And if we can't, what can we do about it and what should we start doing now to fix it? So part one, did healthcare reform diagnose the problem correctly? The reform law diagnoses the problem as lack of health insurance. And it's true, there are up to 50 million people, estimates suggest people don't have insurance. And so the solution that has been prescribed, the treatment order is, let's have more insurance. And so now up to 16 million people will have access to private health insurance coverage, many of them with subsidies. We'll talk about that in a minute. And up to 16 million people could have Medicaid coverage. One of the reasons that so many people cannot afford to cannot get insurance is because they can't afford it, because it's too expensive. And that's because healthcare costs are too high. We're going to drill down on that for the next few minutes. There's a study published in the Archives of Internal Medicine earlier this year that looked at the cost data for uncomplicated appendicitis in the state of California. The researchers had access to data for all the hospitals in the state. And the median cost of a hospital bill to treat uncomplicated appendicitis was $33,611. That amount is 75% of the annual per capita income in the state of California, which was $44,481 in 2011. What's especially interesting is the range of how much the hospital bills were. At the local county hospital, it was only $1,500. At other hospitals, it went up to nearly $183,000. Some of the higher cost hospitals, according to the study, were for-profit institutions. How do we sustain this? Is it sustainable? I'm writing a book on Medicare presently, and I had the pleasure of interviewing a 65-year-old gentleman from rural Kentucky. He went into the hospital for one night for a procedure which he wanted to keep private, but he said he needed an operating room, and chances are he might have had a pacemaker or defibrillator implanted. And he got a hospital bill for $244,000 for that one night in the hospital. And that's about the cost to buy a house in his community. In fact, for some of the houses, you can buy houses cheaper than that in his community. He was on Medicare, and Medicare paid only $18,000. He was so floored by this bill, he called the hospital and said, "What happens if I didn't have insurance?" He said, "Well, we'll still make you pay it." I recently did a radio interview in Washington, D.C., and a woman called in, and she said that her husband had gone in for treatment for kidney stones. He had two of them, and they each cost, the bill, at least the bill they got, was $52,000 for each one. This is the reality of how much health care is costing. And this is why we have health insurance premiums that keep spiking. In 2011, a drug company gained exclusive rights to produce a progesterone shot used to prevent premature births. Used to be able to buy it for $10 an injection. When they gained the exclusive right, they increased the price to $1,500 an injection for a total cost of $30,000 per pregnancy. Is that sustainable? And this happens in the United States because there's nothing to stop it. There's nothing to stop the price increases. In this case, the American College of Obstetrics and Gynecology pushed back. They issued a statement that said, in part, the U.S. healthcare system simply cannot be expected to absorb the cost at its current prohibitive price without significant negative repercussions. In this case, the company backed down. But this is the exception rather than the rule, and individual patients don't have the power to put pressure to reduce their hospital bills. So we have this problem of uncontrolled prices in American healthcare at a time when 32 million people will be getting coverage. We also have an interesting situation in this country with volume. A recent study in the Archives of Internal Medicine was a survey of physicians, primary care physicians. 42% of them